Okay, Ji. So I was talking about the lobes and the segments of the liver. So I told you that first of all we have got the main portal fissure, right, which is marked on the diaphragmatic surface by the cantilever line, and on the visceral surface is marked by the right sagittal fissure. ठीक है जी. Then the right lobe, I told you that it is again divided into the two parts, the right anterior and the right posterior lobe. ठीक है, by the presence of the fissure that is called as the right portal fissure. And you see this right portal fissure, it has not got any external demarcation. ठीक है, इसकी एक external mark नहीं है इसके ऊपर. It is marked by the presence of this right hepatic vein. ठीक है जी. Okay. On the left side, the left lobe, it is again divided into the left medial and left lateral by the presence of the umbilical fissure. ठीक है जी, मैं बात कर चुके हैं जी. Umbilical fissure, it is going to divide into the left lateral and the left medial. Now, और इसमें आपकी लेफ्ट हेपेटिक वेन लाई करती है, राइट. सो जो तीनों फिशर्स हैं जो कि लिवर को 4 पार्ट्स में डिवाइड कर रहे हैं, दीज आर बेसिकली मेन पोर्टल फिशर जिसमें आपका मिडिल वेन ट्रेवल कर रही है, देन द राइट पोर्टल फिशर जहाँ पे आपकी राइट वेन जो है पास कर रही है, एंड द अदर वन इज द अम्बिलिकल फिशर जहाँ पे आपकी लेफ्ट वेन इसको क्रॉस कर रही है. ठीक है जी. और यू सी कि अब यहाँ पे ये दिस इज द पोर्टल ट्रायड कमिंग इनसाइड द लिवर. ठीक है ना, जिसमें आपकी हेपेटिक आर्टरी है, पोर्टल वेन है, bile duct भी आ रही है, राइट. सो दे आर गोइंग टू डिवाइड इनटू द टू ब्रांचेस, राइट एंड द लेफ्ट. सो दिस इज द प्राइमरी डिवीजन. ठीक है. सो द लोब्स, राइट लोब एंड द लेफ्ट लोब, दे आर रिसीविंग द प्राइमरी डिवीजन. ठीक है. जब यहाँ पे आएगी तो इट इज गोइंग टू डिवाइड, जैसे जो आपकी राइट लोब है, इट इज गोइंग टू डिवाइड इनटू द टू. ठीक है ना, राइट एंटीरियर एंड राइट पोस्टीरियर. तो यहाँ पे आने के बाद ये जो है ट्री, इट इज आल्सो गोइंग टू डिवाइड इनटू टू. सो these two segments, these two divisions, they are receiving the secondary division. ठीक है जी, secondary branches of the portal triad. इसी तरह जब ये यहाँ से primary enter into the left हो, तो यहाँ पे जब ये दो में डिवाइड होगा तो it is going to divide into the secondary branches. तो ये हर डिवीजन पे इसकी secondary branch चली जाएगी. यहाँ तक बात क्लियर है जी. Okay. Now when you see that this left lateral division में बात है here, this one. ठीक है. So this left lateral division, this one, and this is a left medial division, right? So this medial division is basically, it's a part of what? It's a part, anatomically, it's a part of the right lobe of the liver. ऐसे ही है जी. ठीक है. And this one is the left, जो आपका left lateral lobe है, that is basically a part of the left lobe. ठीक है, ऐसे ही. Okay. Now, when this vessel which is coming vertically over here, it will going to divide into the two secondary branches to these two left divisions. ठीक है. So it is going to come to lie in this horizontal plane. जब इस horizontal plane में ये travel करेगी, ठीक है, तो it is going to divide these two lobes into the 4 lobes. ठीक है. देखिए यहाँ से इस तरह आएगी ना, it passes to this horizontal plane, right? So this horizontal hepatic plane, which is present at the level of the horizontal part of this portal triad. ठीक है ना, portal triad का ये horizontal part है. जब ये horizontal plane में travel करेगा ना, जब इसको इसमें ये travel करेगा तो यहाँ से it is going to give the tertiary branches to this lobe, this segment, and this segment, and this segment. So these two divisions of the left lobe, these are going to divide into the 4 segments by this horizontal, movement of the portal triad in this transverse plane. ठीक है जी. Is it clear? ये जो vessels, they are going to travel horizontally in this transverse plane.
Yes.
They are going to divide these 2 segments into the 4, these 2 divisions into the 4 segments. ठीक है जी. Is it clear? So the first segment is the name. First segment, number 1 segment, that is basically formed by the caudate lobe. And the four segment that is going to form this by the quadrate lobe, right? And the second and third, these are named as the left posterior and the left anterior defense. ठीक है, left posterior and the left anterior defense. Is it clear जी? कोई प्रॉब्लम तो नहीं है बच्चे कि ये आपकी जो वेसल आ रही हैं, they will run in this horizontal plane, and while running in this horizontal plane, ठीक है, it is going to bifurcate and is going to divide these two divisions into the four segments. ठीक है, first segment, number one segment is represented by the caudate lobe, number 4 is representing the quadrate lobe, and the number 2 and 3, these are the basically named as the left posterior and left anterior segments. यहाँ तक बात क्लियर जी? Now we'll talk about the right lobe. Right lobe में मैंने बताया था जी कि right portal fissure, it is going to divide it into the right anterior and right posterior. ठीक है जी? और इसमें आपकी right hepatic vein travel करती है, right? और again in this case is right lobe, there is no external demarcation. Left lobe में तो external demarcation थी ना जी, we have got the umbilical fissure. लेकिन right side पे we have got no external demarcation. But the similar pattern will be followed over here. There are the two divisions. These two divisions, these are serving the secondary branches of this portal triad, right? So again, the transverse hepatic plane in which the horizontal part of this portal triad travels, it is going to divide these two divisions into the again four segments. Okay? Now, the one which is the right anterior, right? So right anterior, the one which is above this segment, that is called the right anterior superior, and the one below that one, that is called the right anterior inferior. Similarly, the one which is present above, that is called the right posterior superior, and the other one is the right posterior inferior, and they are numbered accordingly, the 5th, 6th, 7th and 8th. ठीक है जी? 5th, 6th, 7th and the 8th segment. So we have got, see, you see, in the liver we have got the 8 segments. ठीक है? 4 on the right side and 4 on the left side. और उसकी क्लिनिकल इंपॉर्टेंस क्या है बेटे? आई टोल्ड यू बिफोर, पहले भी हम डिस्कस कर रहे थे, क्योंकि ऑल दीज ब्लड वेसल्स, ये जो पोर्टल ट्रायड जा रहा है, हर सेगमेंट का अपना पोर्टल ट्रायड जा रहा है. एवरी segment is receiving its own portal triad, right? And the arteries which are going to supply this region, these are the end arteries. These are not going to communicate with one segment to the other segment. So this is a protection from the nature that if something happens to any segment of the liver, right? Tumor ho jata, right? For example, if there is some tumor, okay, some segment has got some infection like a hydrated cyst sort of thing, or sometimes there is a crushing injury due to the roadside accidents. So some part of the liver, it becomes severely damaged. So what we can do, we can just remove that segment, okay, without any excessive bleeding. Okay, so the hepatic segmentectomies can easily be done. Okay, and for this purpose, when we are going to plan to remove any segment of the liver, then we have to follow the certain investigations. And the important investigation which we can do to identify the different segments of the liver, that is to the ultrasonography, some by the injection of the dyes, okay, and then or the other methods, balloon catheter occlusion. So these are the different methods by which we are going to identify the different segments of the liver and to plan that which segment of the liver has to be removed so easily without any excessive blood loss or any damage to the other part of the liver. We can do it by ourselves. Okay, ji. So bache, we have finished with the liver. Okay, left with the a smaller part of the bile ducts and the